What is depression? The term depression refers to a mood condition. It might be characterized as melancholy, grief, or rage that interferes with daily tasks. Also, it's very typical. According to statistics from the Centers for Disease Control and Prevention, 18.5% of American adults in any given 2-week period in 2019 had depressive symptoms. Despite the similarities between depression and grief, sadness or grief experienced after a tragic incident or the loss of a loved one are not the same as depression. Grief normally does not entail self-hatred or a loss of self-esteem, although depression frequently does. Positive thoughts and joyful recollections of the departed frequently go hand in hand with emotional suffering while someone is grieving. Sadness is a persistent sensation in severe depressive illness. Depression manifests itself differently for each person. Your everyday tasks could be hampered, resulting in lost time and decreased production. Relationships and other chronic medical disorders may also be affected. Conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. It's critical to understand that experiencing sadness occasionally is a natural aspect of life. Everyone experiences sad and disturbing things in life. But if you frequently feel down or hopeless, you may be suffering from depression. Without the right care, depression is regarded as a dangerous medical illness that might worsen. Depression symptoms. Depression signs. Depression can be more than just a persistently depressed or blue sensation. A major depressive episode can manifest in a number of ways. Some influence your body while others influence your mood. Additionally, symptoms could continue or come and go. General signs and symptoms. The symptoms of depression vary from person to person. The degree, regularity, and duration of symptoms can all vary. You may have depression if you have experienced some of the following indications and symptoms virtually every day for at least 2 weeks. Feeling sad, anxious, or empty. Feeling hopeless, worthless, and pessimistic. Crying a lot. Feeling bothered, annoyed, or angry. Loss of interest in hobbies and interests you once enjoyed. Decreased energy or fatigue. Difficulty concentrating, remembering, or making decisions. Moving or talking more slowly. Difficulty sleeping, early morning awakening, or oversleeping. Appetite or weight changes. Chronic physical pain with no clear cause that does not get better with treatment, headaches, aches or pains, digestive problems, cramps. Thoughts of death, suicide, self-harm, or suicide attempts. Depression causes. Depression may have a number of reasons. From biological to circumstantial, they might vary. Typical reasons include brain chemistry. People with depression may have a chemical imbalance in the areas of the brain that control their mood, thinking, sleep, appetite, and behavior. Hormone levels. A person's risk for depression may increase as a result of changes in the female hormones estrogen and progesterone at various points in time, such as during the menstrual cycle, postpartum period, perimenopause, or menopause. Family history. If depression or another mood illness runs in your family, you have a higher chance of having it yourself. Early childhood trauma. Some experiences have an impact on how your body responds to stress and frightening circumstances. Brain structure. If your frontal lobe is less active in your brain, you are more likely to develop depression. However, it is unknown whether this takes place before, to, or during the start of depressed symptoms. Medical conditions. Your risk may increase if you have a chronic illness, chronic pain, sleeplessness, Parkinson's disease, a stroke, a heart attack, or cancer. Substance use. Your risk may increase if you have a history of drug or alcohol abuse. Pain. Long-term emotional or physical suffering considerably increases the risk of developing depression in the sufferer. Risk factors. Depression might have physiological, medicinal, social, genetic, or situational risk factors. Typical risk elements include: sex. Women are twice as likely as men to have serious depression. Genetics. If depression runs in your family, you are more likely to get it. Socioeconomic status. Your risk of depression may rise depending on your socioeconomic situation, including financial difficulties and a sense of social inferiority. Certain medicines. Various medications, such as some hormonal birth control methods, corticosteroids, and beta blockers, may raise the chance of developing depression. Vitamin D deficiency. Vitamin D deficiency. Studies have connected low vitamin D levels to depression symptoms. Gender identity. According to a 2018 research, transgender persons have a roughly four-fold higher chance of developing depression than cisgender people. Substance misuse. A drug use problem affects around 21% of those who simultaneously suffer from depression. Medical illnesses. Other chronic medical conditions are linked to depression. It is nearly 2 times more common in those with heart disease than in those without it, and depression affects up to 1 in 4 cancer patients. Treatment for depression. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatments works best. Psychotherapy. You can develop coping mechanisms for uncomfortable feelings by talking to a therapist. Family or group therapy sessions could also be helpful to you. When someone seeks psychotherapy, commonly referred to as talk therapy, they do so to discover and learn to deal with the contributing reasons to their mental health problem, such as depression. There is evidence to support the efficacy of psychotherapy in treating the symptoms of depression and other mental diseases. In addition to drug therapy, psychotherapy is frequently employed. There are several varieties of psychotherapy, and different people react differently to each. Alternative therapies. Consult your doctor about depression alternative treatments. Many people decide to combine conventional psychotherapy and medicine with alternative treatments. Several instances include: meditation. Depression is triggered by stress, worry, and rage, but meditation can help alter how your brain processes these feelings. Studies have shown that regular meditation can assist with depression symptoms and reduce your risk of relapsing into despair. Acupuncture. Traditional Chinese medical practices like acupuncture may be able to reduce some depressive symptoms. In order to cure a variety of ailments, an acupuncturist uses needles to stimulate certain parts of the body. Acupuncture may aid clinical therapies in working more effectively and may be just as helpful as psychotherapy, according to research. Natural remedies and lifestyle tips. Exercise. Aim for 3 to 5 days a week of 30 minutes of physical activity. Endorphins are hormones that elevate your mood, and exercise can raise your body's production of these chemicals. Avoid using drugs and alcohol. Alcohol use or drug abuse may temporarily improve your mood. However, over time, these drugs may exacerbate the symptoms of anxiety and depression. Learn how to set limits. Overwhelming feelings might make depression and anxiety symptoms worse. You might feel better by establishing limits in both your personal and professional life. Self-care is important. Taking care of oneself might help with depression symptoms as well. This entails obtaining enough rest, maintaining a good diet, avoiding unfavorable characters, and engaging in fun activities. Sometimes treatment for depression doesn't work. If your symptoms don't go away, your doctor may suggest trying another course of action. Thank you for watching. View more our channel videos.